What's up, guys? Dr. Brett Rolston, the Ground Overhead PT, coming at you with Daily Body Armor. If you haven't done so, guys, subscribe to the channel for daily content. We're putting out videos every day to give you guys rehab ideas and training ideas so you get back in the gym or back to whatever activity you love without pain as fast as possible. So if you've ever dealt with sciatica, you know that it's very, very debilitating, right? So it can keep you out of the gym or away from your favorite activities for weeks or months at a time. Common symptoms are pain that starts in the low back or top of the hip, either sharp-shooting pain or a dull ache that you just can't quite massage out. And it might go down through the buttock, all the way down the posterior thigh, and sometimes all the way down to the ankle. Okay, so one test you can do to make sure or try to differentiate whether the pain is coming from your hip or your low back is a slump test. And luckily there's a few movements or interventions you can try following up for that test that turn into your treatment. Okay, so all you need is table, chair. You can do this on the side of the couch, but you need to be propped up. All right, from here, what I'm gonna do is I'm gonna bring my chin down to my chest, and I'm going to round my entire spine. Okay, so first, on the asymptomatic, the side that you don't have any symptoms, go ahead and straighten that knee out. Once it's fully straight, I'm gonna pull the foot back towards your head. And that side, you might have some hamstring tightness, but it shouldn't bring about the same symptoms. And then compare that to the painful side. On that side, what we're doing is we're really tensioning that sciatic nerve. Okay, if that reproduces your symptoms, that's a good sign that it's actually coming from your low back. And so what we want to do is follow that up with some gentle nerve glides for the sciatic nerve. So, and then you go in the same position, and what you're going to do, easy way to remember how to keep this straight is the head movement is going to follow the foot movement. Okay, so I'm going to go down, chin to my chest, around my back. As soon as my leg starts coming up, my foot goes back, I'm going to look up towards the ceiling, and when my foot goes down, my head is going to follow. Okay, you go up, head goes up, should feel a little bit of a pull, and back down. Now, we want to do a lot of reps, so 15 to 20 of these is what you're looking for. Now, if you're someone who is really flared up, and even just straighten the leg out like this and bring the toes up really causes a lot of pain, stop just short of that pain. Go right up to the point where you start to feel that tension in that nerve, and then you can keep the leg there and just move the foot, or you can just go straight up to the point where you feel a little bit of tension and back off. Okay, so you don't have to beat your head against the wall and put yourself in a ton of pain. Obviously, we're trying to calm things down. All right, so go up to the point where you start to feel symptoms or a little bit of tension through that sciatic nerve, and then back off. 20 of these on the hour or every couple hours throughout your day, especially if you're someone who's sitting a lot, goes a long way to start to get that nerve to glide better and eventually get you out of pain, guys. So give that a shot, and tune back in tomorrow for another video on how to bulletproof your body and be your absolute best. Thanks, guys.